Have you ever felt a strange pain in your side, worried about what's going on inside your body? Maybe you've been told you need a liver biopsy, and suddenly, the unknown feels overwhelming. What does that even mean? What will happen during the procedure? And why is it important? Today, we're diving deep into the world of liver biopsies. We'll explore what they are, how they work, and why they're crucial for understanding your liver health. Imagine embarking on a journey that starts with a small needle, but leads to big revelations about your body's inner workings. What is a liver biopsy? A liver biopsy is like taking a tiny snapshot of your liver. This snapshot helps doctors see what's happening inside this essential organ. The liver plays a vital role in your overall health, helping with everything from digestion to detoxification. But if something goes wrong, your body might not give clear signals, and that's where a biopsy comes in. By removing a small piece of liver tissue, doctors can diagnose conditions that could be damaging your liver. Think of it as a detective gathering evidence. Each piece of tissue can reveal clues about diseases, inflammation, or scarring. Why do you need one? You might be asking, why would I need a liver biopsy? Well, there are many reasons. Perhaps your doctor has found abnormal liver function tests, or you have symptoms like jaundice, yellowing of the skin and eyes, fatigue, or unexplained weight loss. These are red flags that something may be off, and a liver biopsy can help pinpoint the problem. Imagine you're trying to solve a puzzle with missing pieces. A liver biopsy is one of those crucial pieces that can help complete the picture. It assists in diagnosing conditions like hepatitis, cirrhosis, fatty liver disease, and even liver cancer. The types of liver biopsies. There are two main types of liver biopsies, percutaneous and transjugular. Percutaneous liver biopsy, this is the more common method. It involves inserting a needle through the skin and into the liver to collect a tissue sample. Imagine a gentle tap on your side, not much different from a routine vaccination. Transjugular liver biopsy, this method is slightly different. Instead of entering through the abdomen, the doctor inserts the needle through a vein in your neck. Picture a tiny tube snaking its way to the liver, making the procedure safer for those with bleeding risks. Both methods aim to provide valuable insights about your liver's health, but they do it in slightly different ways. Meet the tools, types of needles. Now, let's get into the tools of the trade, specifically, the needles used for liver biopsies. There are two primary types, cutting needles and aspiration needles. 1. Cutting needles, these have a special design that helps them cut a small piece of tissue from the liver. One popular type is the TrueCut needle. Think of it like a small, sharp knife that's precise and effective, designed specifically for this task. 2. Aspiration needles, these are thinner, hollow tubes that use suction to collect the tissue sample. Examples include the Menarini and Jamshedi needles. Imagine using a straw to sip up a small amount of liquid. These needles do something similar but with liver tissue. The choice between these needles often depends on the doctor's preference and the specific circumstances of the procedure. What to expect during a liver biopsy? So, what happens during the biopsy? Let's break it down step by step. Preparation. Before the procedure, your doctor will give you specific instructions. You might need to stop certain medications or fast for a while. This ensures the biopsy is as safe and effective as possible. The procedure. On the day of your biopsy, you'll lie on your back or your side. The doctor will clean the area and numb it with local anesthesia. Think of it as putting on a shield to prevent pain. For a percutaneous biopsy, the doctor will make a small incision and insert the needle to collect a tissue sample. You might feel some pressure, but it shouldn't be painful. For a transjugular biopsy, after numbing your neck, the doctor will insert a thin tube into your jugular vein, guiding it to your liver. The needle will then go through this tube to collect the sample. Aftercare. After the procedure, you'll be monitored for a few hours to ensure everything is okay. Most people can return to normal activities within 24 hours. But remember, if you experience unusual pain or bleeding, it's essential to contact your doctor. Understanding your results. After the biopsy, the collected tissue is sent to a lab for analysis. This is where the magic happens. The lab will look for signs of disease, inflammation, or scarring. Results can take a few days to arrive, and when they do, your doctor will discuss what they mean for your health. It's like opening a treasure chest of information about your liver. The results can reveal if there's an ongoing disease, how much damage has occurred, and whether treatments are working. Common questions about liver biopsies. What is a Chiba needle? The Chiba needle is a type of aspiration needle commonly used in biopsies. It has a beveled tip that helps collect tissue efficiently. What is a biopsy gun? A biopsy gun is a cutting needle that uses a semi-automatic mechanism to quickly remove tissue samples. It's designed to make the process smoother and faster. Where is the needle inserted? Depending on the biopsy type, the needle may be inserted through the abdomen or the neck. In both cases, local anesthesia will be used to minimize discomfort. The takeaway. A liver biopsy may sound intimidating, but it's an essential tool for understanding your liver's health. By gathering crucial information, doctors can diagnose issues early and determine the best course of action. So, if you find yourself facing a liver biopsy, remember, it's not just a procedure, it's a pathway to uncovering what's happening inside your body. You're not alone in this journey. Many have walked this path before you, and knowledge is your greatest ally. Feel empowered to ask your doctor questions about the procedure, the needles used, and what to expect. After all, understanding your health is the first step towards taking control of it.